Hi, my name is Aya and today I'll be making a presentation on the artificial pancreas for patients with type 1 diabetes. So before I talk about the artificial pancreas, we need to understand the function of the pancreas. The pancreas is a soft, elongated gland. You could say it is similar in shape to a sweet potato. It is located behind the stomach in the upper left abdomen and is made up of 4 sections: the head, neck, body, and tail, as can be seen here. It plays an essential role in the human body through the exocrine function and endocrine function. The exocrine function is responsible for helping with digestion of foods we consume, whilst the endocrine function is responsible for regulating blood sugar in our bodies. In this particular case, I will be focusing on the endocrine function. As I just mentioned, the endocrine function of the pancreas is responsible for regulating blood sugar in our bodies. This means it controls the homeostasis of glucose in the bloodstream. Glucose levels in the bloodstream need to be maintained within a certain range so that there is a constant supply for the cells of the body, but not too much, as excessive glucose can damage the kidneys and surrounding organs. The cells in the pancreas release 2 important hormones into the bloodstream. The alpha cells of the pancreas produce a hormone called glucagon. Glucagon's function is to raise blood glucose levels in the body. It does this by stimulating the liver, causing a metabolization of glycogen into glucose molecules, then releasing it into the bloodstream. The second hormone, insulin, is produced by beta cells of the pancreas. Insulin lowers blood glucose levels in the body. It does this by stimulating the liver, muscles, and adipose tissues, which is basically body fat, into absorbing the glucose. Insulin prompts the formation of glycogen in these areas, storing the absorbed glucose. You may have heard of the disease diabetes and how it affects the function of the pancreas. This disease comes in 2 forms, type 1 and type 2. Type 1 diabetes is an autoimmune disease in which the body does not produce insulin. Type 2 diabetes is acquired and is influenced by factors such as inactivity, poor diet, and obesity. Due to the physiological advancements soon to be mentioned, I will be solely focusing on type 1 diabetes. This type of diabetes is a chronic process that affects the beta cells of the pancreas, consequencing in insulin deficiency. Beta cells are in the pancreas and produce, store, and release the insulin hormone. In type 1 diabetes, the beta cells die as they are attacked by the body's immune system. The cause is still not known to this day. Patients who suffer from type 1 diabetes can experience kidney damage, eye damage, pregnancy complications, and heart disease due to the high levels of glucose in the bloodstream. A cure for this disease has not yet been found, but many new advancements have been made. Current diabetic patients track their insulin levels with a finger stick or a continuous glucose monitor. But with research and medical advancements, the artificial pancreas was created. The artificial pancreas, also known as a closed-loop control, is a diabetes managed system that has been studied for many years. However, it hit a key milestone in 2016 when it was trialed and presented positive results. This system tracks blood glucose levels in patients via a continuous glucose monitor and instantly transports insulin into the body when needed through an insulin pump. It works during the day and night, relieving patients from the stress of having to manage insulin levels constantly. So how does it work? Well, the artificial pancreas is composed of 3 parts: the continuous glucose monitor, also known as a CGM, an insulin pump, or a computer program called an algorithm installed on a smartphone or tablet. The CGM uses a small sensor which is inserted under the skin and takes regular readings of blood glucose levels. This sensor wirelessly transmits the readings to an algorithm program, which analyzes the data and tells the insulin pump how much insulin is needed. An insulin pump is about the size of a small radio and is a device that transports insulin into the body. The insulin is transported through a catheter, which is a thin tube that is inserted mainly into the stomach area. The insulin is then delivered in a fatty tissue, helping to regulate blood glucose levels in the patients. This process takes place when the sensor detects low levels of insulin in the blood. It also detects when there is a low glucose levels in the blood, knowing to stop transporting insulin to the patient. This process can be seen here. So first the CGM sensor takes the blood glucose level reading, sends it to the algorithm, then sends a signal to the insulin pump, releasing insulin into the bloodstream as needed. This advancement has had many great impacts on patients with type 1 diabetes. Results of clinical trials have shown the potential of the artificial pancreas to dramatically improve the regulation of blood glucose levels, decreasing the chronic and acute complications associated with diabetes such as heart disease, kidney failure, and eye damage. It has also shown to alleviate the process and difficulty of self-management of diabetes. The artificial pancreas also provides longer times of normal blood glucose levels in patients, reducing the amount of times insulin pumps are needed. This overall creates an easier and more efficient way for patients with type 1 diabetes, especially children, teens, and elders, to cope with their disease and creates a peace of mind for them. And these are my references. Thank you.